The 2025 government shutdown under the Trump administration has raised serious concerns for millions of Americans, especially seniors, who depend on Social Security as their primary source of income. While Social Security itself is classified as a mandatory program, meaning its core benefits continue even during a shutdown, the operations and staffing that support it are deeply affected. This creates the risk of delays in processing, customer service, and problem resolution that can leave many seniors financially strained. During a shutdown, a large portion of federal employees, including Social Security Administration (SSA) staff, are either furloughed or working without pay. This leads to reduced capacity in handling new applications, benefit verifications, appeals, and adjustments. For example, if a senior recently applied for retirement benefits, disability coverage, or survivor's benefits, their claim might not be processed until after the shutdown ends. Even existing beneficiaries who need to update banking information or report changes to their status could face longer wait times and communication difficulties. Another significant issue is delayed customer support. The SSA field offices may remain open but with minimal staff, and call centers often experience long hold times or temporary closures. For seniors who rely on in-person assistance, particularly those without internet access, this can cause frustration and financial anxiety. The inability to reach SSA representatives may also prevent timely corrections to payment errors, which can disrupt essential expenses like rent, food, and medication. In addition, the Treasury Department, which distributes Social Security payments, may face limited administrative resources. While the funds themselves are secured through the Social Security Trust Fund and are not directly dependent on congressional appropriations, logistical bottlenecks caused by staff shortages could result in payment processing slowdowns or reporting errors. For retirees living on fixed incomes, even a short delay can create hardship. Many seniors carefully plan their monthly budgets around the exact date of their Social Security deposit, and missing even one payment cycle can lead to overdraft fees, unpaid bills, or credit damage. Experts recommend that seniors keep emergency funds to cover at least 1 month's living expenses during uncertain government periods. Monitoring official SSA updates, avoiding scams, and setting up direct deposit can also minimize risks. In short, while Social Security is not shut down, the support system around it weakens, making temporary delays and service interruptions very possible during the 2025 Trump government shutdown. During the 2025 Trump government shutdown, one of the most pressing concerns for older Americans is the potential slowdown in Medicare and Medicaid processing. While both programs are classified as mandatory spending, meaning the government is legally required to fund them, the staff and administrative systems that manage claims, payments, and approvals are heavily affected when a shutdown occurs. This can cause delays in reimbursements, coverage confirmations, and other essential health services that seniors depend on every day. Medicare serves more than 65 million Americans, primarily people over 65, and Medicaid supports low-income individuals, including many seniors in nursing homes or long-term care. Even though the actual benefits remain active, the Centers for Medicare and Medicaid Services (CMS) operates with reduced staff during a shutdown. This means fewer employees are available to process claims from hospitals, doctors, and pharmacies. As a result, some providers may experience delays in payment, which can cause them to temporarily restrict or delay non-emergency services for patients covered under these programs. Prescription drug approvals and coverage checks are another area of concern. Many seniors depend on Medicare Part D for prescription medications. However, if systems are backlogged or certain administrative staff are furloughed, there may be hiccups in verifying coverage or processing new prescriptions. Pharmacies might require additional verification, leading to short-term disruptions for patients who need timely refills. Medicaid recipients, especially those in assisted living or nursing homes, face a related challenge. State agencies administer Medicaid with federal funding support, but if the shutdown continues for weeks, states may start feeling the strain from delayed federal reimbursements. That could force them to postpone payments to healthcare providers, indirectly affecting patient care. Moreover, the Centers for Disease Control (CDC) and National Institutes of Health (NIH) also face reduced activity during shutdowns. This limits public health programs, clinical trials, and research projects that benefit seniors with chronic conditions such as diabetes, heart disease, or Alzheimer's. For seniors, the best defense is staying informed and communicating closely with healthcare providers. Setting up online access to Medicare accounts, keeping a supply of essential medications, and confirming appointments in advance can help reduce inconvenience. In essence, Medicare and Medicaid remain active during the shutdown, but the machinery that keeps them efficient slows dramatically, creating real risks of delays and confusion for millions of older Americans depending on timely medical support. For millions of retired federal workers, the 2025 Trump government shutdown has introduced a wave of anxiety about the stability and timing of their retirement benefits. While programs like Social Security are largely protected, federal pensions and related benefits, such as those managed through the Office of Personnel Management (OPM), can be disrupted when the government halts normal operations. The OPM oversees payments for retirees under the Civil Service Retirement System (CSRS) and the Federal Employees Retirement System (FERS). During a shutdown, many OPM employees responsible for processing new retirement claims are adjusting existing benefits or furloughed. This means that while retirees who are already receiving benefits might continue to get their payments, those who are newly retired or awaiting approval of their pension could face significant delays. In some cases, applications that were mid-process are paused entirely until government funding is restored. Even for those already receiving monthly checks, administrative functions, like tax withholdings, address updates, or survivor benefit adjustments, can be delayed because the systems that handle these changes operate with minimal staffing. If retirees encounter issues such as missing payments, wrong deposit amounts, or tax errors, resolving those problems becomes far more difficult during a shutdown. Another layer of uncertainty comes from the Thrift Savings Plan (TSP), the retirement savings program for federal employees. While the TSP itself continues to function, market volatility caused by political uncertainty can negatively impact account values. Seniors who rely on withdrawals from their TSP or are planning to move funds might find their financial planning disrupted if access or processing slows due to limited support staff. Furthermore, the 2025 Trump administration has suggested that back pay for furloughed employees may not be guaranteed, which fuels broader fears among retirees about potential changes to benefit security or payment schedules. Even though most pensions are funded through dedicated accounts and not subject to annual appropriations, administrative paralysis during a shutdown can still create temporary hiccups that feel very real to retirees living on fixed incomes. To safeguard against these issues, experts recommend retirees set up direct deposit, keep personal copies of pension paperwork, and maintain at least 1 month of emergency savings. Most importantly, they should monitor official OPM updates to stay informed about any changes. In summary, federal retirement benefits themselves remain funded, but the delivery, management, and adjustment processes slow down, leaving many retirees uncertain and financially stressed during the 2025 government shutdown. The 2025 Trump government shutdown has caused a ripple effect that extends far beyond Washington, D.C. One of the most visible and immediate impacts is the closure or scaling back of national parks, senior programs, and local community services that rely heavily on federal funding. For seniors, these closures represent more than just inconvenience. They disrupt recreation, social engagement, and access to vital support systems that help maintain physical and mental well-being. Across the United States, national parks and recreational sites managed by the National Park Service (NPS) have been among the first to feel the shutdown sting. With most park staff furloughed, many sites are closed to visitors, while others operate with extremely limited personnel. For retirees who often enjoy visiting parks for exercise, fresh air, and social interaction, these closures take away safe and affordable spaces for physical activity. In previous shutdowns, unsupervised parks suffered from safety hazards, trash accumulation, and lack of restroom maintenance, making them unsafe, particularly for older adults. But the impact reaches deeper than outdoor recreation. Many senior programs funded or supported by federal grants, such as local nutrition assistance, community centers, and transportation services, are also facing disruptions. Programs under the Administration for Community Living (ACL), which oversees Meals on Wheels and other elder care initiatives, may see temporary funding interruptions. Even short-term gaps can mean missed meals, canceled health checkups, or reduced home care visits for seniors who depend on these services to live independently. At the local level, services connected to federal funding streams, like libraries, health clinics, and senior day centers, may be forced to reduce hours or temporarily close. Staff shortages or delayed reimbursements can push already strained community programs into crisis mode. For isolated seniors, these closures can lead to loneliness, reduced access to social support, and even mental health challenges such as anxiety or depression. Furthermore, volunteer programs that engage retirees, such as Senior Corps or AmeriCorps seniors, may also pause operations. These programs not only benefit communities but give older adults a sense of purpose and connection. In summary, the 2025 government shutdown is not only a bureaucratic crisis, it's a human crisis that touches the daily lives of seniors. From closed parks to paused meal deliveries, the reduced availability of these services highlights how much older Americans rely on community structures supported by federal funding. Seniors are urged to seek out local alternatives and stay connected with community organizations until operations fully resume. One of the most serious side effects of the 2025 Trump government shutdown is the potential disruption to food assistance programs, including the Supplemental Nutrition Assistance Program, SNAP. For millions of low-income Americans, and especially seniors on fixed incomes, SNAP benefits are an essential part of their monthly food budget. When the federal government shuts down, the agencies responsible for funding and distributing these benefits face major operational and financial strain, leading to fears of delayed payments or temporary funding gaps. SNAP is primarily administered by the U.S. Department of Agriculture (USDA), which is among the departments most affected by the shutdown. During a funding lapse, many USDA employees are furloughed, and the department must rely on emergency or carryover funds to keep benefits flowing. In the early stages of the 2025 shutdown, the USDA confirmed that existing funds could sustain SNAP operations for only a limited period. If the shutdown continues beyond that, states might struggle to load monthly benefits onto recipients' cards on time. For seniors, even a short disruption in SNAP benefits can have serious consequences. Many elderly individuals live on small Social Security checks that barely cover rent, utilities, and medications. SNAP provides a crucial supplement that allows them to afford nutritious food. Without it, seniors may be forced to skip meals, buy cheaper but unhealthy food, or rely on food banks that are already overstretched. This not only affects physical health but can also increase anxiety, malnutrition, and the risk of medical complications. In addition to SNAP, other nutrition programs funded by the federal government, such as the Senior Farmers Market Nutrition Program and the Commodity Supplemental Food Program (CSFP), could face similar challenges. These programs help older adults access fresh produce and essential groceries, often through local community centers. When funding is delayed, food deliveries and community distributions are suspended, further isolating vulnerable seniors. Charitable organizations and local food banks often step in during these crises, but they too depend on federal support or matching grants, limiting their ability to fill the gap for long. Ultimately, the 2025 government shutdown exposes how fragile the nation's food security systems are, especially for seniors. Experts recommend that older adults keep extra non-perishable food items, monitor updates from state benefit offices, and seek help from community organizations early. In short, the shutdown threatens not just bureaucratic systems but basic survival for seniors, as interruptions to food assistance programs can directly endanger their nutrition and health. During the 2025 Trump government shutdown, one of the most overlooked yet dangerous consequences is the delay in prescription drug approvals and essential health services. Seniors, who rely more heavily on regular medications and consistent medical care than any other age group, are among the hardest hit by these disruptions. The Food and Drug Administration (FDA) plays a central role in approving new medications, monitoring drug safety, and ensuring that pharmaceutical products on the market remain effective and uncontaminated. However, when a government shutdown occurs, the FDA operates with severely reduced staff and funding. In the 2025 shutdown, a large portion of FDA employees were furloughed, and only critical drug safety operations continued. This means that all non-emergency drug approvals, such as new generics, updates to existing medications, or labeling changes, were placed on hold. For seniors, this slowdown can be more than an inconvenience. It can directly affect their health outcomes and medical affordability. Many older adults depend on generic medications to manage chronic conditions like heart disease, diabetes, arthritis, and hypertension. If new generics cannot be approved or released during the shutdown, prices for brand-name drugs remain high, forcing seniors on fixed incomes to choose between medicine and other essentials like food or rent. In addition, clinical trials and medical research overseen by the National Institutes of Health (NIH) are often suspended or slowed during shutdowns. That means fewer medical breakthroughs, fewer new treatment options, and possible interruptions for patients participating in ongoing studies. Seniors suffering from serious illnesses, such as cancer or Alzheimer's, may find their access to experimental or specialized therapies delayed indefinitely. The shutdown also affects Medicare administrative services, such as claim approvals, provider reimbursements, and medical equipment authorizations. While emergency and hospital care remain available, certain routine approvals or coverage decisions can take longer, leaving patients waiting for essential supplies like wheelchairs, insulin pumps, or oxygen tanks. Pharmacies, too, experience a domino effect. Reduced coordination between federal agencies and healthcare providers can lead to verification delays in insurance claims, causing confusion and wait times at the pharmacy counter. In summary, the 2025 shutdown doesn't just stall government paperwork, it slows the very systems that safeguard seniors' health. With fewer FDA inspections, postponed drug approvals, and lagging Medicare services, older Americans face higher costs, longer waits, and increased health risks. Seniors are urged to refill prescriptions early, stock up on essentials, and stay in close contact with healthcare providers during this critical period. The 2025 Trump government shutdown has not only disrupted government operations, it has also shaken financial markets and economic confidence. For seniors living on fixed incomes, these fluctuations can have serious, long-lasting effects on their ability to maintain stable finances and afford daily necessities. When political gridlock leads to uncertainty in Washington, investors lose confidence, markets become volatile, and inflation pressures rise, all of which hurt retirees the most. Seniors typically rely on stable, predictable income sources such as Social Security, pensions, or retirement savings. Unlike working adults, they often have limited ability to earn additional income when prices rise. During a prolonged shutdown, consumer confidence dips, federal spending freezes, and sectors like healthcare, energy, and services experience slowdowns. This economic stall can lead to short-term inflationary spikes, especially in essentials such as food, medicine, and utilities. For example, food prices may increase as supply chains are disrupted and federal inspections slow down. Fuel prices might rise due to delayed regulatory activity or market panic. Seniors, who already spend a higher percentage of their income on necessities, feel these changes immediately. Even small increases, like a 5% rise in grocery costs or medication co-pays, can destabilize a carefully balanced monthly budget. The stock market is another area of concern. Government shutdowns often cause uncertainty on Wall Street, and markets react sharply to political instability. For seniors with money in 401ks, IRAs, or the Thrift Savings Plan, even temporary downturns can erode their savings and reduce investment income. Retirees drawing from these accounts may have to sell investments at lower values, locking in losses. Furthermore, inflation during times of crisis tends to outpace the cost of living adjustments (COLA) applied to Social Security benefits. This means that even if payments continue, their purchasing power declines, a dangerous trend for retirees who depend solely on fixed benefits. Financial experts recommend that seniors avoid panic-selling investments, maintain an emergency cash reserve, and consult with trusted advisors before making major financial moves during a shutdown. Those with diversified portfolios and stable savings are better protected from temporary shocks, but all retirees should stay informed about market changes and policy updates. In short, the 2025 government shutdown doesn't just close offices, it creates economic tremors that threaten the financial security of millions of seniors. With rising prices and unstable markets, older Americans must plan carefully, conserve resources, and protect their savings from the ripple effects of political and economic uncertainty. In times of political and economic turmoil like the 2025 Trump government shutdown, one of the most important steps seniors can take is to prepare financially and stay informed. Uncertainty about benefits, delayed services, and rising costs can make older adults especially vulnerable. Having a financial safety net and access to accurate information can mean the difference between stability and crisis. The first and most practical step is building emergency savings. Experts recommend that retirees keep enough readily available funds to cover at least 1 to 2 months of essential expenses, including rent, utilities, food, and medications. While many seniors live on fixed incomes, even small, consistent savings contributions can help cushion unexpected disruptions. These savings can be held in a separate checking or savings account that's easy to access but not used for daily spending. During shutdowns, government services like Social Security, Medicare, or SNAP may experience processing delays. This means monthly deposits could arrive late or administrative issues might take longer to resolve. Seniors who rely on every payment to meet living costs should avoid cutting it too close each month. Maintaining a small buffer ensures they can continue paying bills, buying groceries, and filling prescriptions even if there's a short-term interruption. In addition to saving, seniors should make it a habit to stay informed through reliable sources. Many older Americans become targets of misinformation or scams during government crises. Fraudsters often take advantage of confusion, pretending to be Social Security or Medicare officials asking for personal information. To stay safe, seniors should only trust updates from official websites such as SSA.gov, Medicare.gov, or recognized news outlets. It's also wise to sign up for email alerts or contact local senior centers for verified information about benefit changes or assistance programs. Seniors should also review their automatic payments and bills. If a delay in government income is expected, it might be better to contact utility companies, landlords, or creditors in advance to explain the situation. Many offer hardship programs or flexible payment plans during national crises. Finally, emotional preparation is as important as financial readiness. Sudden disruptions can cause anxiety or loneliness, especially for older adults living alone. Staying connected with family, neighbors, and community groups can provide both emotional support and practical help. In essence, during the 2025 government shutdown, seniors who plan ahead, save wisely, and stay informed will be best positioned to weather the uncertainty with confidence and security.